Lindsey, I'm Sarah.
Hi there.
Hi, I'm a CNL student at Umass, and I'm going to be performing a health history interview and a physical exam on you today, okay?
Okay.
So I'm just going to be jotting down some notes, just so I can get to know you a little bit better. Tell me how you identify yourself as a sex, female, male, transgender.
Female.
Okay, and how old are you?
33.
And what is your ethnicity?
American.
Okay, and what brings you in today?
For my yearly physical.
Okay, and when was your last physical? Do you remember?
About a year ago.
All right, and do you know the results of that?
Everything was fine.
Everything was fine. Okay, great. And now just talking a little bit about your health status, how do you describe your current health status?
I think I'm pretty healthy for the most part.
Okay. And your maintenance strategies, do you exercise?
I try to exercise a couple times a week.
Okay, and what do you like to do?
Go for walks.
And where do you walk on a treadmill, or are you part of a gym, or?
No, I walk outside with my daughter.
Okay, great. All right, so you have a daughter?
Yep.
And how old is she?
7.
7, okay. And do you see a dentist on a regular basis?
Yeah.
You do, okay. And what about a skin doctor, dermatologist?
No.
No, your primary care physician assesses your skin and your moles for
Yep.
abnormalities? Okay. And OBGYN care?
Yep.
You see
Yearly.
yearly, okay. And is that through like a women's health group, or is that through your primary care?
No, it's a separate.
It's a separate thing.
Yeah.
Okay. And vision, do you see an ophthalmologist?
Yearly.
Yearly. Okay, great. Any other specialty?
Yeah, I see a neurologist.
You see a neurologist. Okay, and what do you see the neurologist for?
Migraines.
Migraines. Okay, and how often do you see them?
Just as needed.
Okay, and when was your last visit?
A couple months ago.
And what were the results?
Everything was fine.
Everything was fine. Okay, great. Okay. So, what about your routines or habits? Do you have any routines that you incorporate into your daily activities to help you sleep or to help you stay awake?
No.
Nothing like that?
No.
Do you drink caffeine?
No, not regularly.
Okay, and do you use any over-the-counter medications or any medications to help you sleep or stay awake?
No.
Okay, and how many hours of sleep do you get a night?
Around 5.
Okay, and do you feel rested with that amount of sleep?
Yeah, for the most part.
Do you nap at all?
No.
No, okay. And what time do you go to bed?
About midnight.
Midnight. And what time do you wake up?
5 o'clock.
5 o'clock, okay. Okay. And some of your stressors in your life, do you have any current stress?
Just my family.
Your family, okay. And what about your family is stressful?
My sister has issues with substance abuse.
Okay, and how do you deal with that? Do you see?
I just try to isolate myself from it and not really get involved.
Okay, and are you coping with that stress pretty well right now?
Yeah.
Okay. Have you ever seen a therapist or used talk therapy to get through?
Yeah, I've been to therapy in the past, but didn't find it useful.
Okay, all right. And now just moving on a little bit about your past medical history. Tell me about your allergies, if you suffer from any allergies.
Just sulfa drugs.
Sulfa, okay. And any environmental allergies, including latex?
Nope.
Nothing. Food allergies or intolerances?
Nope.
Nothing. Okay, and childhood illnesses or hospitalizations that you can recall or that would be pertinent?
I had a hernia repair when I was 2,
Okay.
and I just had the chicken pox.
And do you have a chickenpox scar?
No.
No, okay. And immunizations, are they up to date?
Yep.
And what about as a child?
Yes.
Okay, and that includes your tetanus, pertussis, diphtheria?
Yep.
And your flu?
Yep.
Any pneumonia vaccinations?
No.
What about the HPV vaccination? Nothing like that?
No.
Okay. And what about your current illnesses or diagnoses? You said you suffer from the migraines. Any other medical history?
No.
Nothing else? No elevated cholesterol? No other diagnoses that you suffer from?
No.
Okay. And what about your OB history? Can you tell me a little bit about your OB history?
I have 1 child.
Okay.
C-section.
C-section, okay.
Yeah.
And how was getting pregnant? Was that okay for you?
Yeah. It was good.
No problem.
No.
And the pregnancy itself, any issues there?
No.
Diagnoses? No. And the delivery, was it a planned C-section or
No.
so it was an emergency section? Any complications from the
No.
C-section? Okay. Any issues after the C-section?
No.
Okay. And so, excuse me, you see your OBGYN yearly.
Yep.
You get regular pap smears as indicated, and then you see them as needed.
Yep.
Okay. And self-breast exams, do you get a self-breast exam when you're there?
Yes.
And do you incorporate self-breast exams into your daily routine or
No.
into your monthly routine?
No.
You don't. Okay. So we'll talk a little bit more about the importance of that. Tell me, do you have any trauma? Any physical, mental, any sexual childhood trauma? Nothing like that. So no trauma whatsoever.
No.
Okay, great. And you said the results of your last physical exam were good, and the results of your last neurology exam were okay.
Yeah.
What medications do you take on a regular basis? Did you happen to bring them today?
I do.
Oh, great.
I take Tylenol for my headaches.
Okay.
And ibuprofen for my headaches.
Okay.
And then a prenatal vitamin.
Okay. And you take the Tylenol and ibuprofen as needed?
Yep.
How often do you feel like you take them?
I would say at least once a day.
Once a day. Okay. And the prenatals you take daily?
Yes.
And why are you taking the prenatals?
I'm trying to get pregnant.
Okay. And what about with the Tylenol and ibuprofen? Is that something you and your neurologist advised and came up with?
Yes.
And is that plan and treatment method working for your migraine control?
Yep.
Okay. And what about drugs or substance abuse?
No.
Nothing like that.
No.
Do you smoke?
No.
Have you ever smoked?
No.
What about alcohol?
Occasionally.
What's occasionally?
Maybe once a month.
Okay. And ever used any kind of drugs or anything like that?
No.
Nothing like that. Okay, good. So talking a little bit now about your family history, any pertinent information that you can recall from your grandparents?
Grandparents on my father's side, my grandfather had dementia
Okay,
and high cholesterol,
okay,
and his mother had breast cancer with mets.
okay. And are they still alive?
No.
Okay, how old were they when they died? Do you remember?
Early 90s.
Both of them?
Yep.
And do you remember what they died from? Do you know? If they...
I think my grandmother died of cancer,
Okay,
and my grandfather just old age.
old age, okay.
Dementia.
And you're on your mom's side?
My grandmother had breast cancer as well,
Okay,
and I don't know much about my grandfather.
oh, okay. And your parents?
My mother has a history of breast cancer,
Okay.
and my father has high blood pressure and prostate cancer.
And anything else that your mom has besides the breast cancer? Otherwise?
No.
And is she in remission now?
Yes.
Okay, and when was she diagnosed? Do you remember?
1994.
Okay, so she's been in remission for some time. And your dad with the prostate cancer, is he in remission?
Yes.
Okay, great. And when was he diagnosed?
Just a couple of years ago.
Okay. Okay, so siblings, you said that you had
One sister.
one sister. Okay, and any pertinent medical history on her side?
Just her substance abuse.
Okay. Okay, so now talking a little bit about psychosocial aspects of your life, what is your current living situation?
I live with my husband and our daughter.
And how long have you been married?
7 years.
Okay. And do you guys own a home?
Yes.
Okay, so, and financially you feel somewhat secure?
Yep.
Okay, any issues with debt or anything like that? You own your own home, so that's good. And then what about, you have transportation to work and stuff?
Yep.
And what do you do for work?
I'm a nurse.
You're a nurse, okay, great. And what does your husband do?
He's a police officer.
Okay. And who would you consider your immediate support system?
I would say my husband.
Your husband, okay, great. And your immediate family, who do you consider? Are you close with your parents or his parents or?
Yep. My parents and his mother.
Okay. All right, great. Um, and then what about safety? Do you have fire detectors?
Yep.
Smoke detectors?
Yep.
And then carbon monoxide?
Yes.
You have all that. Okay. Do you wear your seatbelt?
Yes.
Do you encourage your daughter to wear your seatbelt?
Always.
And then what about, excuse me, sunscreen or eyeglasses?
Yep.
You wear sunglasses when
Yep.
it's sunny. Okay. And then what about your mood and your any issues with your mood or diagnosed with depression ever or anxiety? Nothing like that. You feel well overall?
Yeah.
Okay, mentally. Okay. Okay. Excuse me. So just touching base, you said you were married, you live with your husband. Are you guys in a healthy sexual relationship?
Yep.
Okay, and you're trying to get pregnant?
Yep.
How long have you been trying to get pregnant?
About a year.
1 year. Okay. And are you using any kind of medications or anything like that? Any techniques to help you?
No.
No. Okay. And you're just using the prenatal vitamins?
Yep.
Okay. And so are you both in a monogamous relationship?
Yes.
Any history of STDs or HIV scares or anything like that?
No.
Nothing that you would be concerned with? Okay. Okay, all right. So now I'm just going to kind of talk you through the systems, and you can kind of address anything pertinent that I touch base on that we might have forgotten here that would help me during the physical exam.
Okay.
Okay, so any recent weight gain or loss?
No.
Okay, and any recent illnesses, flu-like illnesses, stiffness in your neck, anything like that?
No.
Nausea, vomiting, nothing. Been healthy this year so far.
Yeah.
Good. You said you suffer from the migraines, and you said that you see the neurologist and the ibuprofen and Tylenol are helping.
Mhm.
How many days a month do you suffer from pain in your head that is diagnosed as a migraine?
Probably half.
Half of the month. Okay. And do you have any other head pain or ever been diagnosed with any other kind of headaches?
No.
Okay. Any scalp pain or hair issues?
No.
Thinning,
No.
lesions in your scalp, nothing like that. And you see an ophthalmologist.
Yeah.
Do you wear corrective glasses or anything like that? Ever had eye surgery?
No.
History of infections?
No.
Drainage? Dryness?
No.
Nothing like that. Okay. Hearing. Do you have any trouble hearing?
No.
And ever suffer from chronic ear infections as a child or anything like that?
No.
Any buildup of wax or any kind of ear pain at all?
No.
Okay. And nasally, do you have a known deviated septum?
No.
No. Okay. So you breathe freely through your nose. Ever had a bloody nose or dryness to your nose?
No.
Nothing like that? Post-nasal drip?
No.
Sinus pressure or pain?
No.
Okay. And dental, you said see a dentist. Any current dental pain or issues there? Any lesions, canker sores?
No.
Throat pain?
No.
Tonsillar issues? Bad taste in your mouth or anything like that? Okay. Any trouble swallowing?
No.
Ever been diagnosed with thyroid issues?
No.
What about your glands? Any tenderness to any of your lymph nodes or anything like that on a regular basis or when you get sick?
No.
Not that you notice. Okay. And breathing wise, do you have any feelings or episodes of shortness of breath,
No.
wheezing,
No.
coughing? Ever been diagnosed with asthma?
No.
Exercise induced asthma? Nothing like that. Ever had pneumonia?
No.
Okay. Heart problems? Ever had any heart problems?
No.
Chest pain?
No.
Palpitations? Ever been diagnosed with a murmur?
No.
Ever feel a fluttering sensation or anything like that? Ever stand up and then have a sensation of being dizzy or blacking out?
No.
Ever passed out unexpectedly? Ever had any coolness or issues with your circulation in your extremities? Nothing like that?
No.
Okay. And your breasts, you see the OBGYN,
Mhm.
You have a significant breast cancer history here, so we definitely need to touch base when we're doing the physical exam
Mhm.
on the techniques and tips of how to do a self breast exam, and you need to start incorporating that into your monthly routine. And do you do breast exams?
No.
You don't. Okay. Only when you see the OBGYN.
Mhm.
So yeah, that's something that we'll need to go over and we'll need to be really kind of diligent about that'll be our goal for the next year, okay? To really get to know what's normal for you.
Okay.
In the meantime, any asymmetry that you've noticed, any discharge from your nipples, any redness, swelling, pain,
No.
any pain in your lymph nodes under your armpits?
No.
No, okay. And what about mastitis? Did you ever have mastitis?
Only after my daughter.
Do you know which breast?
I believe it was the right.
Right, okay. And so you breastfed
Mhm.
for how long?
6 months.
Okay. Okay, great. And abdomen, you said you had the hernia repair,
Mhm.
the appendectomy,
Yep.
and the C-section.
Yes.
Any other surgeries to your belly?
No.
Any distension or bloating?
No.
Any excess gas, nausea, vomiting, diarrhea? Food intolerances, you said no to.
Right.
Bowel movements pattern, is it?
Regular.
It's regular? Okay. Any history of constipation?
No.
Okay. And have you ever been diagnosed with Crohn's or colitis?
No.
Okay. And what about rectal pain?
No.
Bleeding? Ever been diagnosed with a hemorrhoid?
No.
Do you ever strain when you have a bowel movement?
No.
Okay, great. Vaginally, any spotting, any kind of abnormal bleeding?
No.
Any discharge, lesions, pain? What about pain when you have sex?
No.
No. Okay. And what about your menses? Are they regular?
Yep.
They are. Okay. And how many days apart are they?
Usually every 28 days.
28 days. And how many days per month do you bleed?
Between 4 and 5.
And is it light, medium, heavy?
Heavy.
Okay. And have you ever been diagnosed with anemia?
No.
Ever needed a transfusion?
No.
Nothing like that. Okay. What about musculoskeletal wise? Have you ever had any muscle pain,
No.
joint pain or swelling, any warmth or redness to any of your joints?
No.
Upper back or lower back pain?
No.
Nothing like that. Okay, good. And then what about urinary symptoms? Ever had frequent urinary tract infections? Have you ever had a urinary tract infection?
Yes.
You have, okay. And any incontinence after your baby?
No.
No issues like that.
No.
Okay. Any flank pain or pain where your kidneys would be?
No.
Does it ever irradiate around? Nothing like that. Never been diagnosed with a kidney stone?
No.
Okay, good. And then finally, we'll just talk a little bit about neurology stuff here. So, any sensation issues,
No.
numbness, tingling? Ever notice that your strength isn't equal?
No.
No. Okay. Any balance issues?
No.
Any vision or hearing issues or speaking when you have a headache?
No.
Nothing like that. Ever been diagnosed with a seizure?
No.
When you get your migraines, do you have any vision?
No.
No other symptoms,
No.
just the pain?
No.
Okay. And okay. Any sensation issues? Like, do you have trouble feeling things that are sharp or soft?
No.
And what about intolerances to heat or cold? Anything like that?
No.
No. Okay. And just to go back here really quick with the migraines, do you suffer from any other side effects like nausea or vomiting? It's strictly
No,
pain.
yeah.
Just pain. Okay. Okay, so I think that we've covered everything today for the interview, and I will see you soon for the physical exam. Okay? All right, nice to meet you, Lindsey.
Nice to meet you too.
Take care.
Thank you.